he talks about the soothe to danger ratio, meaning that a lot of us have danger, danger, danger through things like the news and social media and notifications, and then perfectionism, people pleasing, lack of boundaries, always being stimulated and late, the
Mhm.
never-ending to-do list, negative self-talk, repressed emotions, like all of that stuff is going on all the time. And so our brain is just sort of stuck in this danger, danger, danger. And there's not enough of like this soothe ratio, which makes us come out of this fight or flight and tells your brain that you're safe. And so these
Mhm.
symptoms tend to be sort of like the remnants of this danger to soothe ratio that's a little bit lopsided.
So honored to have Allie Damron back on the podcast today. So Allie was on, I think we were a few weeks ago, not weeks ago, years
Yeah,
ago,
I know.
and had such a great conversation. I can't wait to jump into everything you're talking about today. So thanks for being here.
Yeah, thanks so much for having me.
Yeah, absolutely. So I know we're very much on the same page talking about like, the back pain and then nervous system regulation, how that made a huge difference in our lives. Do you mind just sharing your perspective on the nervous system and how that really affects our healing journey and is essential to our healing
Yeah,
journey?
absolutely. So I think a lot of people, in fact, it's actually like known that about 1 in 3 primary care visits, about 25 to 30% of the US population at least, has something called like neuroplastic conditions. And those are things that are like back pain, neck pain, shoulder pain, IBS, vertigo, tinnitus, heart palpitations, anxiety, like long COVID, all these things that we see people struggling with. And they're all symptoms that kind of like come and go, maybe change. Sometimes they're worse, sometimes they're better. Although they can be consistent, they can like present that way too. But we treat them in this way of like thinking about them from a really physical standpoint, when in reality, we know from a lot of scientific research, years and decades of clinical experience from really amazing doctors, you and I's own experience, and millions of other people, that the nervous system plays a huge role in this. And I
Mhm.
think that I describe it in this way, that our brain is always detecting danger, threats, scary things. It's like always scanning around. And so when it finds scary things, it's going to put you into fight, flight, freeze, or fawn response, which changes our body chemically. It changes all kinds of things. We have a cortisol receptor on almost every cell in our body. And so it can change your digestion by suppressing it, your immune system by suppressing it. It can burn through your neurotransmitters, so serotonin, dopamine, GABA, which makes you feel really calm. It changes our blood flow and our blood circulation. It increases blood pressure. It impacts our detoxification and our hormone levels, so making things like perimenopause or menopause worse. It obviously impacts our muscles. A lot of us have really tight muscles in our body. And so I think that, we're missing the boat a lot on some of these symptoms and can be treated by so Dan Buglio is one of my mentors. I love him. He comes from Pain for You, and he and I also, like you and I, have very similar kind of parallel journeys. But he talks about the soothe to danger ratio, meaning that a lot of us have danger, danger, danger through things like the news and social media and notifications, and then perfectionism, people pleasing, lack of boundaries, always being stimulated and late, the
Mhm.
never-ending to-do list, negative self-talk, repressed emotions, like all of that stuff is going on all the time. And so our brain is just sort of stuck in this danger, danger, danger. And there's not enough of like this soothe ratio, which makes us come out of this fight or flight and tells your brain that you're safe. And so these
Mhm.
symptoms tend to be sort of like the remnants of this danger to soothe ratio that's a little bit lopsided.
Yeah, absolutely. It's so, I mean, as you're speaking, it's like, oh my gosh, it's just that long list that I think every one of us has experienced. And we're like, yeah, oh my gosh, how do I even begin to soothe myself
No.
when this is my life? Can you talk to like that person who's like, just listen to
Yeah.
that list and they're like, yeah, I experienced every one of those. And maybe they are feeling some of those symptoms. Maybe they do have pain or they're noticing they are around perimenopause and they're experiencing a lot of really rough symptoms right now. How
Yeah.
does that person start to navigate a better ratio with that when maybe they feel like there's so many life experiences that they're having right now?
So in terms of like symptom relief as a whole. So we can talk about it like if you have back pain or insomnia or IBS symptoms or something like that, how do you get through those symptoms? And then we can talk about overall like nervous system stuff. So when my patients come to me and they're like, I have neck pain, back pain, IBS, whatever, I'm like, okay, there's two sides of the coin in this healing journey. Number one is the response of the symptoms itself, because we get into this cycle with symptoms that's called the symptom fear symptom cycle, where basically we get a symptom and it feels scary. And sometimes people don't always resonate with like fear as the primary response to it, but it can be like frustration, annoyance, irritated with it, in despair or anguish with it. So it doesn't have to be that, like, oh my gosh, I'm scared to death, although it can be.
Mhm.
And once we experience that, then the brain is like, oh my gosh, this must be a big alarm, a big emergency. It must be a big deal. And so it actually like magnifies that sensation. And so anything that your brain deems as scary or a big deal or a problem to solve, pressure to fix or whatever, your brain is going to turn on those alarm bells. So I always describe it as kind of like if you're walking down the street and saw like a sketchy person to the on the other side of the street of you or whatever, your brain would notice every movement that they make because
Mhm.
it's threatening to your survival. And so it would want you to be really hyper vigilant to that person walking across the street. Whereas if they weren't perceived as dangerous, you wouldn't notice much about them. It'd just be like, oh, there's a person over there, not a big deal. So our body is very much the same way. We can become very hyper vigilant. These sensations can be magnified when we feel like there's a big problem to solve or they're a big deal. And that's what happens in neuroplastic symptoms is that your brain is like actually laser focused on them with like fear and attention is basically the equation for chronicity of symptoms.
Mhm.
So I always tell people the first side of the coin in healing physical symptoms or anxiety, OCD, depression, insomnia, it doesn't have to be necessarily pain, is to really work on the response to the fear, despair, whatever, and attention to it. We want to start to eliminate that piece of things. And you do that through number one, clarity of what's going on. So you have to understand, Dr. Sarno, who originated this diagnosis, talked about knowledge therapy and really understanding that like there is nothing actually structurally, chemically wrong at this point that's not reversible through healing the nervous system. You're safe. There's actually nothing wrong. This is a false alarm. And once people understand that, it takes people varying times of or lengths of time to understand that and feel safe in that diagnosis. Some people read it on them, like read it and they're like, oh my God, this is me right off the bat. They know. Other people, it takes some coercing to be like, this is what's going on. I promise. This is why. And it takes them a few days, weeks, months to like let that set in. But I do think that first, if you can get the clarity and the safety of knowing this is what's going on, you're not broken, that dials down the danger signals a lot. And then understanding that, like, through somatic tracking, which is just basically sitting with the sensations, that's a great part of pain reprocessing therapy. You can start to find some safety in those sensations and turn down the danger signals in your brain so that it stops sending you the signals of those symptoms. So I always think like that's kind of the first step is the response to the symptoms. The second side of the coin would be why is your brain feeling so endangered? Like what part of it? And to your point, I think a lot of people have a laundry list of things. It's, financial stress, the news, the perfectionism, the repressed emotions. And so when I'm working with my patients, I really just kind of ask them like where, like bird's eye view, where do you feel like the stress is coming from? And we just kind of start to unravel it in that way. Sometimes the lowest hanging fruit can be like, let's turn off social media and the news quite so much so that we're not just doom scrolling all the time and getting that input. I mean, it's addictive and it's hard, but it's a lower hanging fruit than obviously working through your perfectionism. Um, and so we start there, sometimes notifications and like overstimulation. So like how can we set up your workspace where like you're not just ding, 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 getting bombarded every day? Can we turn off things? Can we put do not disturb? Can we put on focus mode? Can we set boundaries around when you're going to answer emails instead of just having them run in? I think those things are like the lower hanging fruits of things. And then even with like perfectionism, people pleasing, some of those harder ones, I actually think that there's a lot of generation of repressed emotions with those. Because when we're a people pleaser or perfection, I think that generates a good amount of internal anger and
Mhm.
rage, which Dr.
Absolutely.
Sarno talked about anger and rage as being like one of the primary repressed emotions. it feels crappy, especially if you have that personality profile of being like good and a people pleaser and not wanting to face emotions. Anger is a tough one to swallow for a lot of people.
Yeah.
Feels big and intense, and it might feel like kind of like a personality flaw. You don't want to be that type of person. And so a lot of people shove that down with everything they have. And so I tend to work first on kind of like the self-awareness. And I know you talk about that a lot too, of like, what is actually going on? Are we repressing emotions? A lot of women, I think, also will be like, oh, you just need to be grateful and stop. It's not that big of a deal. Just get over it. They didn't mean it. We sort of like gaslight ourselves out of it. And we don't have to like sit in a place of being an angry person all the time, but we can actually acknowledge and sort of validate our internal experience, I think, of like, this is genuinely how I feel. I don't love the way I feel about this, but it is my truth, my story. And kind of getting a little bit better about honoring that. And I think that tends to be a great place to start of like you always say, like unraveling the onion, because there is always a place to go, unfortunately, or fortunately.
Yeah.
It's kind of a cool journey once you get on it, and it's not so new because it feels clunky at first.
Mhm.
I think you probably experienced that. I did too. It's hard at first, but it doesn't always feel
Mhm.
so hard.
Yeah, I so appreciate you talking about like gaslighting yourself because that's such a common experience. Like I know I've experienced that before of like I shouldn't be angry, like oh just let it go, like and then that how we use gratitude to kind of bypass the emotions that we're experiencing. It's such a common experience, especially for women who people please or perfectionists, where you feel like you're
Totally.
not safe to experience those emotions. So I think it's so important to bring that up because it's something that we've often experienced. And I'd love for you to go into like languaging because one thing, like working as a physical therapist, I can tell you how many people are like, my body's broken. This is the worst thing ever. I'm never going to X, Y, and Z walk again. I'm never going to be able to jump again. Like there's so
Yeah.
much language that people use that is so like fear driven, but might not use it because it's like reactionary. Do you mind diving into that a little bit more of
Yeah,
like
totally. So,
languaging
number
the fear?
one, I think that again, clarity is the biggest thing because in the neuroplastic community, the pain, the symptoms absolutely are terrible and they're real and they hurt. It's not just coming from your head. It is truly a pain danger signal. It's coming from one of the 44 different pain centers in the brain. We can see it on functional MRIs. And so that's kind of like the first thing is that I'm not saying that this is in your head. It's absolutely real pain. I've experienced it. You've experienced
Mhm.
it. It felt real. But part of like again the I'm broken, I'm never going to be able to do this, that is part of like the I call it like the TMS brain, which is tension myositis syndrome. That is the thoughts that you get. I had them, I'm sure you did too, where I was really young with chronic back pain for 5 years and like couldn't lift up my kids, didn't know if I'd ever be able to run or like lift weights again or be out of pain or like go on walks. My husband's like an ultra marathoner. Like I've never done it, but that's what he does. And I wanted to be active with him. And so a lot of the thoughts around that are totally fear driven around like you're never going to. So number one, never, always. There are parts of these that are called cognitive distortions, which are things like all or nothing thinking, so very concrete, very black and white thinking. I think catastrophizing or predicting the future are also big ones in this space. And so when you notice that you're doing that, you have to kind of make the conscious decision to be like, this is a cognitive distortion. These thoughts are only coming from a scared brain. Scared brains will give you all kinds of thoughts to give you all the information and plan it all out and catastrophize and figure it out in that way, but it's not based on reality. And the cool thing is, once you get into neuroplastic or TMS healing, is that there's actually nothing wrong with you. It is not structural damage. There's no tissue damage. There's nothing that prevents you, even from like this moment on, doing some of the things that you want to be doing. The pain is high, which means the fear is high. And so it's really just all about reducing the fear. And so, to your point, the language around it, if you say like, Alan Gordon is another psychologist who came up with the Pain Psychology Center, and he talks about this a lot around like instead of saying like piercing or throbbing, it's like pulsing or like strong sensations. He like really tries to dial down like this strong fear-driven language with his patients because your brain's always listening, and if it can sense 100 times over if it's coming from a place of despair, fear, frustration, annoyance. And it will keep those danger signals going.
Mhm. Yeah, thank you for sharing that because it's so important because it's something, again, reactionary we can just say. We don't realize that impact of that language when we are driving those behaviors and the wiring patterns in our brains. And as you were speaking, something else I would love for you to dive into
Yeah.
is when we go to practitioners, because I had this experience when I was 25 and I had the back pain, and I went to a practitioner. They showed me the x-ray of my spine. They're like, your L4, L5 is half the disc height. They went and showed me the model with the red, and it was just such a like fear-driven image. And before I knew better, before I was a physical therapist and didn't know any of this stuff, and
Yeah.
I took it as truth. I was like, oh my gosh, I'm 25. I'm never going to be able to do this, this, and this. Thinking of like, what if I have kids in my future and I can't do that because of the pain? I was totally like
Yeah.
taking it as absolute truth. Can you speak to that on when we go to practitioners and they're saying it and we look at them as authority figures versus being our own inner authority?
100%. So this is one of the hardest things I think a lot of people have to overcome is this idea called the nocebo.
Mhm.
So again, and I actually had this experience a couple weeks ago with my mom in the hospital. So my mom went to go get a port put in on Halloween, and there was this woman next to us in like the bay in the radiology, like interventional radiology department, and this really well-intentioned, amazing, sweet doctor who was also doing my mom's procedure talked to this woman, and she had been in the hospital for sciatica.
Mhm.
So she was hospitalized for it. It was like very severe. She was in a wheelchair, like couldn't move at all. And she came down there and he was going to maybe like cauterize a nerve or I think it was just give her an injection, actually. I think it was a X-ray guided or ultrasound guided injection for it. And she was like terrified to do that. She was terrified of the pain. She was crying. She was like a mess. And I was like, oh my gosh. And he came over to her and was like, so in your back, the nerve is basically being pressed on by these really tight muscles. And so the nerve's really irritated, and we just need to go in, calm down the inflammation, like all the things that we've heard. And this woman was too scared to do the injection. She was too scared. And he was like, well, are you just going to sit in the hospital all weekend? And she was like, well, I guess. And there was just no good answers for her in that moment. And I was like, you just need neuroplastic healing. Like, you're fine. This is all
Mhm.
good. But my point being in that, then she had had all these physicians who looked at these MRIs, probably CT scans, X-rays, etc., be like, your nerve's really irritated. These muscles are pressing on it. These bones now, this disc now here. And so that is going to be something for her that's probably going to be a huge hindrance to healing because she can look at those structural things and be like, well, are you sure? Because all these like authoritative figures said that this is what's causing this. But we know in so many ways that we call them normal abnormalities. So people have disc degeneration, they have herniated discs, they have spinal stenosis, they have spondylolisthesis, they have things in their bodies, and that's just back pain. There's all kinds of other ones too that are normal abnormalities. And the hard part is, and I think you and I and all of our army of people are trying to go to chiropractors, physical therapists, acupuncturists, pain meds, osteo doctors, like orthopedic surgeons, all these people to say, this is not what's causing pain. It just doesn't. We've gone through the Boulder back pain study. We've looked at Dr. Sarno's work. We've looked at, there's Dr. Hanscom and Strax and Schubiner and all of these doctors who have all these different disciplines have looked at this until they're blue in the face for 3 decades. We know that these things do not cause pain, they do not cause symptoms, but I do think that the nocebo is hard to overcome. When I
Mhm.
was going through my own back pain, in fact, I actually worked at a chiropractic office. And so that was challenging to say the least. And I heard every day be like, you got to come get adjusted 3 times a week, every week for the rest of your life. That's the only way you're going to stay out of pain. Or like I asked my own chiropractor, like, okay, well, cool. It feels great when I get up out of this bed, but the minute I walk to my car, it comes back. How do you get an adjustment to stay? And they're like, well, that's the million-dollar question. And I was like, well, that's fantastic.
Mhm.
Um,
Yeah.
so yes, I mean, just as much as there's placebo, which I am 100% a fan of placebo, if we can get our brain feeling safe that things are working and that's what works, fantastic. But there's also this idea of the nocebo, which is, people of authority or whatever say things to you that make it hard to overcome. And so that's something that we're constantly battling, I think, in the neuroplastic community.
Yeah, absolutely. And then where would that like balance between like seeking out a medical professional because they definitely serve a purpose and have like
Absolutely.
versus like what when someone's like feeling that, when would they maybe explore different options with medical and pursuing a little bit more of that neuroplastic treatment?
So yes, and so one of like the principles in the neuroplastic community is to rule out the physical. And
Mhm.
that is a tough thing because a herniated disc would technically be physical, right? And so that is sort of the hard thing. There have been a lot of doctors, all the ones that I mentioned, that have created something called the FIT assessment or different assessments that you can take to see if your symptoms might be neuroplastic.
Mhm.
Neuroplastic symptoms behave in a specific way. They, like I said, come and go. They might change pain locations. They might have come on after no like technical injury, although injuries also can become neuroplastic. So healing in our bodies are miraculous at healing. We can heal a broken femur in 8 weeks without any like passively, right? We just stay off of it and your body goes to work and does the thing. And so it's unrealistic to assume that like whiplash, right, in our neck would be there 2 to 10 years later or whatever. You know, people say 20 years later they still have whiplash. That would be not realistic to believe that that would be occurring. That would be definitely a flare-up of neuroplastic pain. And so I think first taking the assessments to see if your pain might go in the direction of neuroplastic type pain. I also think ruling out the physical. So go to your doctor and say, "Hey, I'm having this weird symptom or whatever. Just want to make sure it's not something like infection, cancer, tumor, stroke, heart attack, um, pancreatitis, like some of these acute things that Western medicine's amazing for. My mom has cancer right now. I've been in the Western medicine world a lot with her recently, and they're great. I love doctors, but there are certain things that they just, a lot of them don't have the understanding yet, and hopefully we are moving in that direction. And so you do want to rule out those types of things. But other than that, really treating it, like I said, 1 in 3 primary care visits are due to neuroplastic conditions.
Mhm.
I'm pretty conservative and don't just like tell people like, yeah, this is exactly what you have when I don't know. I do always ask them to rule out the physical or give me the opinion of their doctor, the imaging or whatever, so that we can look and make sure. Because I
Mhm.
never want people to miss things. I've obviously gone through catastrophic things with my family in terms of cancer and strokes and heart disease and things like that you don't want to miss, of course. Um,
Mhm.
but otherwise, treat it as neuroplastic for the most part.
Yeah, absolutely. And then I would love to like go further into it is like for someone who's feeling that back pain, a lot of times they go to the doctor and like they're so quick to prescribe the medication, which then masks the symptoms. How does that work? I know because like the root of it we need to get to, but can you talk to that person who maybe is on pain medications? It is being masked, but is still struggling with that, how that all plays a role when navigating more the root cause of things.
So I actually think that medication's fine to be on while you're working on it. Again, I think that there's in neuroplastic healing, there's something called avoidant behaviors, which are anything that you do to avoid the pain. So it can be medications, it can be meditation, it can be pillows, certain positionings, avoiding certain surfaces, standing for certain times. It could be, you know, taking like sleep medication to sleep better, anything that you do to avoid the symptom. And
Mhm,
that can be like very benign things all the way to surgeries and medications
mhm,
are called avoidant behaviors. So I look at it in terms of kind of like the symptom scale. So when I'm working with my patients, if their symptom is somewhere between, and this is more like fear driven. So like if their fear or preoccupation with the symptom is about a 7 out of 10 or higher, I do an avoidant behavior because that will help you create safety. Sometimes I do think that like having a way out creates safety in the brain away
yeah.
from suffering. And so I absolutely do, if they need to do something, do that. If it's
Mhm,
below that where they can find it in a tolerable way, then I'm like, let's do some somatic tracking. Let's sit with it for a few minutes. And somatic tracking is basically like, in terms of You can do it for emotions or a lot of different symptoms, but let's think about it in terms of pain. It would be like sitting with the pain for somewhere between 2 seconds and a couple minutes, even.
Mhm.
And just kind of saying, like, okay, brain, I know you feel like this is a big danger signal. I know this is terrifying to you right now, but we're here to explain to you that this is actually a safe sensation. This is a false alarm. We're actually okay. Here it is. We're not like bracing and avoiding and moving to get rid of it. We're okay to sit here for a second. And really the treatment to overcome neuroplastic pain is to slowly but surely pick up one after one of those corrective experiences where you provide some safety around the symptom. So to get over it, you do have to expose yourself to the symptom because that's the only way that your brain's going to find safety around it. But if it's too high for you to do that, do an avoidant behavior. Do something to make yourself more comfortable so that you can find some safety with it.
Yeah. Do you mind sharing some of the examples of some of those exposure behaviors?
Yeah, so for example, so like in terms of back pain, it would be depending on like where you are. So if you're somebody who like can't sit in a chair, right? It would be like sitting in a chair for 5 seconds, 10
Mhm.
seconds, 2 minutes, like whatever. We want to push you a little bit with it.
Mhm.
We don't want to invite a panic attack or like severe pain flare up. That generally leads to a setback. There are
Mhm.
certain people, there's a book called The Great Pain Deception by Steve Ozanich that was like a classic TMS neuroplastic type of book, and he had really severe back pain. He was like a total masochist about it and was like, I am sitting in this chair until this pain goes away. Tend to think that doesn't work the best for most
Mhm.
people. I think maybe a more gentle approach of kind of coercing gently is a bit better. And so that might look like, again, sitting in that chair. It might look like going on a walk around the
Mhm.
block if you have foot pain. It might look like not sleeping with a pillow between your knees that night. It might look like, for insomnia, it might look like instead of freaking out in the middle of the night when you're awake, oh my God, I can't sleep. This is so miserable. I hate this. What's wrong with me? What do I do? It might look like turning on a podcast to keep your brain occupied while saying, like, it's safe that I'm not sleeping in the night. I'm resting. We're okay. This is safe. We'll sleep at some point. This isn't a big deal. It might look like kind of working through some of those kind of catastrophic fear-based thoughts.
Mhm.
With anxiety, it might look like calling it out, identifying and validating, okay, this is uncomfortable. This is just anxiety. It's just threat physiology. I actually have recently kind of stopped calling it anxiety and started calling it more like threat physiology because that's really what it is. It's not a condition necessarily. It's not catastrophic. It's not something you're gonna have to live with for the rest of your life. It's your brain's fire alarm going off to tell you it's scared, it's in danger. And so I think, kind of even going back to the language, like anything you can do to dial down the fear is a good thing. Um, and so I think like does that answer your question around exposures?
Yeah.
It's like doing some of those things. For me, I had to start eventually lifting again.
Mhm.
Deadlifting was like a big hurdle for me. I had to start running again. And the thing is, at first, running did cause pain
Mhm.
because my brain had perceived running as this big mountain, this big dangerous thing to do. And so, of course, it sent pain back. It said, you said that running was really dangerous. Here's your pain to go with it, to not
Mhm.
do it anymore. And so it's like, nope, you got a glitchy message. We ran for a long time before we got pain. We know that we can do this without pain. This is not a painful activity. And so it's just like reteaching it. And the process of reteaching it is the same exact process that you learn to ride a bike, to read, to talk, to walk. It's just picking up those slow corrective experiences over and over and over.
Yeah, yeah. Thank you so much. Yeah, I think that's what really brings a lot of clarity to anyone who's like considering this as a practice or like integrating this into their life of like what does that look like and how do I navigate that? And do you mind just sharing your experience when you integrated this a little bit more of like
Yeah.
after doing that, where are you now as far as how you feel in your body?
Yeah, so I mean, I have not had back pain in over 10 years, none at all ever. I had chronic SI joint pain. Sometimes it changed sides here and
Hmm.
there. Felt like a knife was generally stabbing me in there every single time I bent over, for 5 years. And I'd never ever have pain now. It was a journey. And the thing is, when you're in pain, all you want to do is get out of pain. That's like the only thing you can think about. And so it's interesting now that I couldn't even tell you how long it's really been since I've had pain. I know it's been around 10 years based on the ages of my kids.
Mhm.
It's probably actually been closer to 12 now. But the interesting thing is, I never thought I could get to this place, but you eventually, with this healing, get to this place where the pain is still kind of present. You don't care that it's there. And
Mhm.
I heard that before I was there, and I was like, there is no way I can ever get to this place where this pain is not going to drive me insane, make me super anxious, keep my attention 100 times a day, or like 500 times a day. But you do eventually get to that place where you're like, okay, I'm having a little bit today, not a big deal, it's fine. And I always explain this to patients. So like mine was back pain, but if I have a patient with back pain and I'm like, what if you woke up with a stomach ache? You'd be like, wow, that's really kind of annoying. I don't really like that. Maybe you take some Pepto-Bismol, maybe you just kind of wait it out. Maybe you'd say like, oh, maybe I ate something weird, but it wouldn't be triggering to you, right? You
Mhm.
wouldn't have that like fear and attention, but your back, you have that fear and attention. Whereas somebody else that woke up with a stomach ache that was around neuroplastic would be terrified,
Mhm.
right? They'd be like, oh my God, it's back and freak out about it. And so it's all about our perception of these pains, and fear makes it a million times worse. And so
Mhm.
once I had dialed down that fear and just didn't really care that it was there, I specifically remember when I was in that place. I was in a 24-hour fitness parking lot. I was about to go in for a run. I still had some pain and I didn't care. And I was like, holy cow, this is what I've been working for. I notice this pain is there. I don't care. It's not that big of a deal. I know it'll go away. I'm
Mhm.
done with it. And so at that point, after that, I don't know when it went away, but it went away at some point after that.
Yeah, thank you so much for sharing again. Because if someone is listening to this and they have that pain and they can very much relate to, like, I can't even imagine being at that
I get
place.
it.
Like,
You can't until
yeah,
you.
to hear your story and be like, you got to that place when you couldn't imagine that, it just inspires
Totally.
that hope that there's so much more possible for you to release yourself from the pain that you've experienced for maybe years. So,
Absolutely. I mean,
yeah,
some people have had pain for 30 years,
right.
14
Hmm.
years, 10 years, like even longer than my pain. And I had a lot of actually like OCD around it looking back. I
Hmm.
would bend over and touch my toes like literally hundreds of times a day just to monitor it and be like, oh my gosh, is it there? Is it not there? How bad is it? It was like really tied into OCD with it too.
Hmm.
It created that for me. So it was wired in there really tight.
Mhm. Yeah, which is more of a testament of the power of all
Yeah.
this, and that
Mhm.
you can rewire your brain no matter how long you've had it or how severe it is. And
Yeah.
that's really just powerful to hear. And I think just hearing that for someone who's maybe feeling that can be really a big catalyst and changing the way that they're living right
Mhm.
now. And so for someone who's listening and wants to work with you or connect with you, where can they find you?
Yeah. You can go to alliedameron.com/consults. I offer free discovery calls, or we can chat about, do we think this is what's going on? You probably are like this too. I generally can tell quickly with
Mhm.
somebody if that is what it is after doing this for I mean, myself for over 12 years. I went through a couple years of it. And then, just studying it, working with hundreds of patients, it's pretty obvious at this point, like what it is. Again, always, I'm super conservative. I never guess for
Mhm.
sure. I like want to know for sure. Um, so you can go to alliedameron.com/consults, do a free discovery call. We can chat about it. Or I'm always on Instagram where I share a lot of this information. I do think that it's really helpful in the early days. Like I said, you've got to start with kind of knowledge therapy for it. And so I do think that it's really helpful to listen to podcasts, YouTube channels, read books on it. There's a lot more people now that discuss this than when I started this. There was like one website, a couple books out there, and now there's so many people who coach, have podcasts, YouTube channels that have like amazing resources. So there's a lot more information about it now than there used to be.
Yeah, which is amazing. Just the shift that
Absolutely.
things are making, where we're really addressing the root rather than
Yeah.
just masking things.
Amazing. Like there's
Yeah.
doctors practicing in this way. I'm like so hopeful that we can change the opioid crisis, how we treat chronic pain, like in chronic pain clinics and GI Like it's amazing.
Mhm.
I think that we'll get there.
Yes,
Insurance will be better. Like the whole thing will be way better.
totally. It's such a ripple effect because of this amount of money that's poured into this. But yeah, the opioids and then the complications of that, gabapentin. I just reading an
Yeah.
article on that, which is prescribed now so much. But yeah, there's so many things that can benefit from this where we become our own advocate, become our own healing source, and realizing the power we have from within to
Mhm.
really change our life and the way we're functioning in the world. So I appreciate
It's like the
everything.
real deal, right? It's like
Yeah.
truly, like, this is what's actually happening.
Yes.
Not like this esoteric, airy-fairy thing. Like this
Mhm.
is actually how to get out of pain
Right. Yeah.
symptoms instead of
Mhm.
seeing treatment after treatment after treatment when your body's like kind of responding, but not really.
Absolutely. And what I love about it is like, so many, I think people from my experience with people I've worked with have become so disempowered in their pain journey that this really brings the power back to them to realize that they have this ability to transform the way they're experiencing life, which I think of absolutely amazing. So I'm so grateful for everything you shared. I know it's going to make a tremendous difference in
Yeah.
someone who's listening, who's maybe experiencing that pain and to really live differently from here on out. So thank you.
Yeah. My pleasure. It was absolutely awesome to be here with you today.
Yes, definitely. And again, anyone who's listening, connect with Allie and dive into all the resources she has. Thank you so much for tuning in and share this episode with someone you think could also benefit from it. Thanks so much for being here.